I've been reading this study about naloxone distribution, and
Oh,
it's really fascinating.
what's so interesting about it?
Well, they're trying to figure out exactly how much naloxone we need across different states,
Right.
especially with the varying opioid epidemics like fentanyl, heroin, and prescription opioids.
So they're looking at different types of opioid crises in different areas?
Exactly. Each epidemic type affects communities differently, so the
Hmm.
naloxone needs aren't the same everywhere.
That makes sense. How did they go about estimating these needs?
They developed this mathematical model incorporating overdose risks, access points, and the potency of the drug supply,
Okay.
and calibrated it using data from 12 representative states.
Wow, that's comprehensive. Did they consider how naloxone is distributed?
Yes, they looked at three main access points: community-based programs, provider prescriptions, and pharmacy-initiated distribution, and how
Right.
each impacts the likelihood of naloxone being used during overdoses.
Interesting. Which access point was most effective?
Community-based programs and pharmacy-initiated distribution were far more effective than provider prescriptions,
Really?
especially in fentanyl-dominated epidemics.
Why is that, do you think?
Well, it's because these methods reach people who are most at risk more directly,
Hmm.
and they facilitate broader access to naloxone in the community.
That makes sense. So in areas with fentanyl issues, they need more naloxone?
Exactly. Fentanyl is so potent that overdoses happen quickly, so having
Yeah.
naloxone readily available is crucial.
What about prescription opioid-dominated areas?
Those areas actually had the lowest probability of naloxone use during witnessed overdoses,
Oh
sometimes as
no,
low as 0 to 20%.
that's surprising. Any idea why?
It could be due to overdoses being less likely witnessed or less awareness about naloxone, so
Right.
increasing education there is important.
Absolutely. Did the study suggest how many naloxone kits are needed?
Yes, but it varies by state. To achieve 80% naloxone use in witnessed overdoses, some states need over 1,000 kits per 100,000 people, while
Wow.
others need fewer.
Were any states meeting that target already?
Actually, only Arizona had sufficient kits to meet the target in 2017, which is
Really?
impressive.
That's great for them. But it sounds like other states have a lot of work to do.
Definitely. The study emphasizes substantial expansion in nearly every state,
Hmm.
especially through community programs and pharmacies.
Do you think provider prescriptions aren't cutting it?
Well, they found that relying solely on providers isn't as effective because it
Right.
doesn't reach high-risk individuals as efficiently.
That makes sense. People at highest risk might not be seeing a doctor regularly.
Exactly. Community distribution can bridge that gap, making
Yeah.
naloxone more accessible.
But isn't there a concern about funding for such programs?
That's a valid point. Funding and policy barriers do exist, but the
Hmm.
cost of inaction is much greater in terms of lives lost and economic impact.
True. The study mention any economic figures?
Yes, overdose deaths are associated with annual costs of over $20 billion, which is staggering.
Wow. So investing in naloxone distribution could actually save money in the long run.
Exactly. It's both a humanitarian and economic imperative,
Right.
saving lives and reducing costs.
Couldn't agree more. Did they talk about any other benefits?
They also highlighted the importance of addressing structural issues like unjust drug laws and systemic barriers, because
Yeah,
naloxone distribution alone isn't enough.
that's so true. We need to tackle the root causes as well.
Absolutely. It's like treating the symptoms without curing the disease, so a comprehensive
Exactly.
approach is necessary.
Do you think policymakers will act on these findings?
I really hope so. The data provides a clear direction, and it's
Hmm.
crucial that we adapt our strategies based on solid evidence.
Agreed. It's about time we make substantial changes.
Definitely. The study gives us the tools to do that, so let's
Yeah.
hope it leads to real action.